Hey, what up all my tooth doctors and doctresses, and welcome back to the Tooth Factory. Let's continue where we left off with the cholinergic system and its drugs. Alright, let's get into the cholinergic system, also known as parasympathomimic system. We're going to talk about the cholinergic drugs, the pharmaceutical actions of them, their classification, and anticholinergic drugs, their pharmacological actions, and their classification. Make sure you rest and digest. Alright, let me explain this in a neurological form first. This is acetylcholine, the neurotransmitter of the cholinergic system that is formed and released by the parasympathetic nervous system into the synapses. Into the synapses there are two things. It will follow through and attach at the receptor at the target organs, or it will be broken by an enzyme called choline esterase into acetylcholine, and then choline will be taken back into the vesicles and then released, and this system is regulated by this enzyme. Now I have drawn 3 dots here. I will make sure I explain all of them in the coming slides. First of all, what is cholinergic pharmacology? It does act at different target organs. First, at the cardiovascular system, it relaxes the smooth muscles and decreases total peripheral resistance. What that means is that it reduces the heart rate, it reduces the blood pressure, and thus decreases the cardiac output. So heart relaxes. Remember, rest. The gastrointestinal system, in which it excites the smooth muscles, increases the motility, activity, and secretions of the gastric system. Hence, it leads to digestion. Remember, digestion. The glands are hyperactive in the cholinergic system with increase in secretions of all glands, including the lacrimal glands and the salivary glands. The eyes are also affected by causing a meiosis, which is a constriction of the pupil. It does accommodate near vision, decreases intraocular pressure. This means that it can be used for treatment of glaucoma, as glaucoma is the opposite, increase in intraocular pressure. The cholinergic drugs, they're also known as parasympathomimic drugs. They are further divided into direct acting and indirect acting. We'll talk about this section later. Coming to direct acting, the cholinergic agonists are further divided into choline ester and alkaloids. These drugs include acetylcholine, bethanchol, carbachol. They fall under the choline ester. Pilocarpine falls under the alkaloids. Acetylcholine is a neurotransmitter at both sympathetic and parasympathetic system and at preganglionic neurons for all of them. Rapidly hydrolyzed by body cholinesterase, and then they are reuptaken by the vesicles in the presynaptic membrane. Their effects are produced both on muscarinic and nicotinic actions. Like we know, parasympathetic receptors are muscarinic and nicotinic, and their neurotransmitter is acetylcholine. Bethanchol. It is used in the treatment of urinary retention. Remember that increase in intestinal motility and stimulation of bladder, increase in secretions is the role of cholinergic system. Carbachol. Open angle glaucoma, narrow angle glaucoma. Therefore, it reduces the intraocular pressure and causing rapid meiosis, which is the constriction, pupil and ciliary muscle. The pilocarpine from the alkaloids is used in treatment of xerostomia, therefore increasing the salivary gland productions, open and narrow angle glaucoma, decreasing the intraocular pressure, and urinary retention by increasing the urine output. At this point, it is important to mention that cholinergic drugs will act directly at the receptor sites by increasing the stimulation at it so that acetylcholine can be further accommodated into the receptor and their muscarinic and nicotinic actions can be taken forward. Indirect acting will be taken in the next slide. Indirect acting anticholinesterase drugs will act by reducing the effect of cholinesterase enzyme to increase the acetylcholine to the postsynaptic receptors into the target organs. Number 1 in reversible is physiostigmine. Urinary retention, glaucoma, and reversing the effects of atropine, which is an anticholinergic drug, is the job of physiostigmine. Number 2 is neostigmine. It works in the treatment of myasthenia gravis. It is the antidote for tuberculin poisoning. Androphonium works in just the diagnosis of myasthenia gravis for short durations. And again, it is still the antidote for tuberculin poisoning. Eicosapentaenophosphate, irreversible. Organophosphate, also irreversible. Both of these drugs work on irreversibly inhibiting cholinesterase, so it enhances the effect of acetylcholine. The eicosapentaenophosphate will work in open-angle glaucoma to reduce the intraocular pressure. Organophosphate is also known as a nerve gas sarin. It is also used as a pesticide in agricultural. Its effect will lead to paralysis and then death. This is a poison, but it can be reversed by pralidoxin, as it reactivates the acetylcholine esterase enzyme and reduces the effect of acetylcholine. Now, the remaining drugs, which were of the reversible kind, are used for Alzheimer's disease. Cholinergic drugs, direct acting, indirect acting. Direct acting directly acts on the parasympathetic receptors, which is this dot. Indirect acting works with release of neurotransmitter, so releasing acetylcholine, and which goes to receptor site. Then the other irreversible and reversible anticholinesterase will work to inhibit the enzyme cholinesterase. These are the basic functions of cholinergic drugs. The anticholinergic drugs are classified into 3 sections: antimuscarinic agents, neuromuscular blockers, and ganglionic blockers. Antimuscarinic agents include atropine, scopolamine, ipratropium, cyclopentolate, and topicamide. The atropine is an antispasmodic for GI and bladder as it relaxes their muscles. It surpasses respiratory secretions prior to surgery, so helps the surgeon. It is an emergency drug for organophosphate poisoning and hypotension with bradycardia. Again, recall the actions of anticholinergic drugs to prove the roles of each drugs. Scopolamine. It works in anti-motion sickness or in sedation as well. Ipratropium bromide works in asthma as it reduces the respiratory smooth muscle actions causing bronchodilation. Also in COPD with the same function, chronic obstructive pulmonary disease. Number 4, cyclopentolate, and number 5, topicamide, both are used in mydriasis and cycloplagia prior to refraction for ophthalmologic and optometric purposes. These block the muscarinic receptors that the acetylcholine binds to. Number 2, neuromuscular blockers. The neuromuscular blockers work such as succinylcholine, tuberculin, atracurium, doxacurium, pantacurium. These are all the non-depolarizing neuromuscular junction blockers. They are used with anesthetic for relaxation. Then the rest of the drugs. Succinylcholine, most importantly, is a depolarizing neuromuscular junction blockade for rapid endotracheal intubation so that the upper respiratory tract muscles are relaxed. The ganglionic blockers are mecamylamine, hexamethonium. Their actions are nicotinic acetylcholine receptor antagonism. So the presynaptic signals that a CNS sends to the ganglion for relay, that is blocked. So whether it is sympathetic or parasympathetic, it doesn't matter. It blocks them both. Therefore, the clinical use is in moderate to severe hypertension. Hypertension because when there is an increase in blood pressure, the sympathetic nervous system comes into action, and then this blocks the ganglions, as ganglions have nicotinic receptors, and therefore reduces the blood pressure. So even though this is a parasympathetic drug, it works as antihypertensive drug as well. Again, just a recap of atropine, which is an anticholinergic drug. Number 1, ophthalmologic examination, so dilation of the pupils. Number 2, Parkinson's disease, as it relaxes the muscles. Number 3, motion sickness, as it reduces the gastrointestinal activity. Number 4, in dentistry, we use it to create a dry field, as it reduces the secretions of the salivary glands.